Most patients can perform a side bend. I'm doing this in unsupported sitting, but you could perform this while sitting on a couch. And exhaling as you perform lateral flexion, usually about 5 reps. Blowing out as you make your way over. And you'll notice some coughing at the beginning, which is a good thing. Give them a chance to clear that. Works best with trunk flexion. We were performing the same thing, but to the other side if needed. If the patient only has lung congestion on one side, you can just do the one side, but usually they have a little bit on both. And here again, we do trunk flexion with forced exhale, reaching arms forward. Give them a chance to expectorate if possible. Now we're going to add in some trunk flexion and rotation, which honestly, even my patients with pretty severe mobility issues are able to perform. And this is very helpful with getting things moving and getting them to produce a cough. If they're not able to get their arm up overhead, you can perform it with a reach out and over to the side. It's also a great rib cage stretch, shoulder stretch. If they're not able to do that, you can reach down to the knee and reach toward the floor. So we're showing 3 variations here. At the beginning, the hardest with the arm overhead, and then reaching out to the side and then down toward the knee. And of course, performing it to the other side if needed. Important point being to exhale as you perform the crunch. And you'll notice your patient will have a wet cough, more so the first couple times that they perform any of these exercises. And the cough will loosen and lessen as they produce them. And this is a good thing, so you want to encourage that. Give them a rest break to cough and clear as needed with trunk flexion, forward reach, like we saw earlier. Diaphragmatic breathing is something that takes some practice. It's an inhale with belly rising, little to no chest movement. Exhale with belly collapsing. Best performed in supine, but can also be performed in sitting, and is something that should be done for at least 10 reps. Takes a lot of practice though. One of the ways you know you're doing this correctly is when you feel a little bit of a pressure underneath your sternum and a definite change in your rib cage position on the lower end of your ribs. So be patient with your patients. It may take a little while. Coach them through it. Practice it yourself. It makes a world of difference. Pulsed breathing, as shown here, is a great way to get your patient to start tuning into the power of breath, recognizing the power and position of their transverse abdominis, and to start working on a breath they're probably familiar with. This is most likely going to cause a cough, so you can begin or end your session with this to get some expectoration. Inspiration with arms overhead, sucking air in through a straw. Arms coming down slowly is another great expectoration activity, and can be done in supine, sitting, or standing. And then slowly blowing it out after you've held it for a second. This exercise has been very effective in moving mucus up out of the lower lobe and helping a patient to get it to a place where they can expectorate it. Here it's performed while lying propped on pillows. If that's not able to be tolerated, they can be flat or in any acceptable position. This is another position, if tolerable, putting pillows underneath. The objective here is to try to get your lower lobes at a higher level than your upper lobe. So of course, this would be ideal. So if you have a patient that can be in this position, this would work best. But if not, just be creative. Take what they can give you. Here's our final trunk flexion coughing that we started with at the beginning. Try to end your session with this. You'll see that they'll probably be coughing less than they were at the beginning. And I really love to do a lung check with my stethoscope at the beginning. And again, at the end, you usually hear a difference and they feel better.